Welcome to Bay Area Psychology. Breast cancer is a serious health epidemic in America that annually kills almost as many women as the number of people killed in the 10 years of the Vietnam War. These statistics have not changed in 30 years. Yet, according to the Breast Cancer Center, most women do not practice breast examinations because they are afraid of finding something they fear that will inevitably lead to a mastectomy. After all, Rose Kushner points out in her book, Why Me? It's if they were good girls and did as they were told and find a lump or other symptom, they are rewarded by having their breast removed. This fear continues to exist despite current expanded treatment options. In the face of painful statistics, you may be tempted to change the channel tonight. I know that preparation for tonight's show is at sometimes uncomfortable for me as well. Yet, ultimately, I feel more in control with more information and not less. So I want to encourage you to stay with us this evening. Tonight, we will examine blocks to routine self-care and seeking early treatment. We'll look at feelings we may experience after diagnosis and treatments and steps we can take to live our lives well. Joining us tonight is Elaine Dornick from the Bay Area Breast Cancer Network. And joining us also is Pat Field, who has offered to share her experience with us with this particular disease. I want to thank you ladies both for coming out this evening and being willing to share your experience with us.
Thank you for having us.
You're welcome. Now, Elaine, I understand you are one of the founding members of the Bay Area Breast Cancer Network.
Yes, I was diagnosed with breast cancer in 1989, and shortly thereafter saw a letter in the paper talking about the need for women to come together to do something about this disease. So a handful of breast cancer survivors and thrivers did form this nonprofit organization, hopefully to increase awareness about the disease and to make the process more manageable for other women.
Well, and I imagine, as I mentioned, there's some fear that women need to be able to be desensitized to. I mean, and part of where my introduction came from is, as I was preparing the show and mentioned the topic, several women said, "Oh, I don't know if I want to watch that," and it had to do with fear about hearing something that they could relate to. Mm-hmm. Was that your experience prior to your diagnosis? How did you feel about breast cancer?
I think that I felt that it was someone else's problem.
Okay.
And certainly that would never happen to me. I remember as a younger woman taking birth control pills, for example, they said that might be related to breast cancer, but that was someone else's disease. That wasn't my disease.
Okay.
I didn't practice breast self-exam regularly, but I did do it.
Okay.
Yeah.
Yeah. Well, and that movement from it's somebody else's disease to mine, I'm sure must be quite a difficult ordeal. Was that your experience?
It's tremendously difficult.
Okay.
I was 49 years old at the time and a healthy, energetic woman, and certainly wasn't thinking of breast cancer or any other major health issue. And I think when you face that diagnosis, as Pat said, you haven't anticipated yourself having a diagnosis like this. And it's, for me, I think, the mortality issue is very, very front and center.
Indeed.
Uh-huh. And I think in my case, the more information I was able to gather, the more I was able to learn, I began to feel a little more control over this life of mine and whatever it would be. And then I think once you accomplish each of the steps on the diagnostic journey, so to speak, things begin to fall in place.
And you begin to feel like it isn't something maybe necessarily that's happening to you, but it's something that you are in fact part of the process.
Yes.
We have our first graphic I wanted to take a look at some psychological aspects or feelings women may have prior to receiving this diagnosis. Let's take a look. Denial. Maybe for a lot of us initially, we don't do breast exams, we don't go to a doctor immediately, and some women don't even accept treatment when they are diagnosed. Another particular aspect might be paranoia, that with over 183,000 women diagnosed with breast cancer, 70% having no known risk factors, women are sometimes choosing prophylactic mastectomies, and am going to want your input about that at some point. And then anxiety, you know, will I be one of the 8% of women who might be diagnosed during my lifetime? And so, as you mentioned, I don't think you can separate that out from the mortality issue. And this fear of one of the ways I can get control might be to go ahead and have my breast removed in advance, even though I don't have any known symptoms or risks. Have you experienced women making those kind of statements or feeling like
Actually, actually, I don't hear a lot of women considering prophylactic mastectomy in a general sense.
Okay.
I mean, sometimes that's a consideration with a particular kind of breast cancer that tends to also develop in the other breast.
Okay.
But I don't really see that among the population that we're working with. I think it's enough to just deal with, you know, the biopsy and lumpectomy perhaps, or mastectomy. That's all-consuming for
Okay.
women as they go through the diagnosis. At least that's the way I feel. I don't know, Pat, if you have any thoughts on that.
Well, I do know 2 women that have had prophylactic mastectomies on the opposite side, but not that have done that without a prior diagnosis of breast cancer.
Okay.
But their prognosis was serious enough that they felt more comfortable having both breasts removed.
Okay. You know, I think part of Ms. Kushner's study came out of talking to women who were perhaps concerned, and I know the kind of doing the biopsy and then having the mastectomy at the same time. I think that's called first option or something like that. That for a long time, one step, yeah, that it came out of that where, you know, women would say, well, if you find anything, and then they'd wake up and, you know, their breast might be removed. And I understand there's now quite a shift to people saying, you know, no, let's take some time after diagnosis to really
Right.
think this through.
Actually, when I was very much younger, I was expecting my first daughter. When I was 26 going on 27, I had a lump in my other breast, and at that time, because it's so long ago, I signed a consent form, and had that been malignant, they would have just gone ahead with a mastectomy. But today, there is clearly a 2-step procedure, and if we've learned anything, it's that we have adequate time to get good information to make careful decisions.
This has a little bit of a double edge, though, because it's very good to have choices, and women are given the chance to make the decision oftentimes, do they need a lumpectomy or a mastectomy? But on the other hand, it's difficult to make that choice if your future medical prognosis is based on a decision that you have to make, and you're not a doctor, and you're left with the decision. So again, information, as much information as you can get is a way of getting control over that. But there is no right answer oftentimes.
Well, and I would guess, too, that, you know, I have not experienced this myself, but my guess would be the emotions at that time would be so powerful that trying to make this kind of intellectual medical care decision in the throes of having the feelings that I can imagine may appear must be even more difficult. You know, because it's not just, you know, should I buy a Ford Fiesta or, you know, a Caravan. I mean, this is going to impact the rest of your life. And how did you know, did you go through a 2-step process, the 2 of you?
Yes.
How were you able to do that, to be able to sort out the information at the same time as feeling?
Well, in my case, and I usually am comfortable gathering information, but my brain was like Swiss cheese, I think, you know. So my youngest daughter, who was a senior in high school, and my husband went to Stanford Library, medical library, kind of did all the research from the books. I got on the telephone, and I talked to people who had had breast cancer, had been through the process, and that was okay for me. I was able to manage that much more than sitting down and reading information. But it's an extremely difficult time, and people react in different ways, you know. Just as our cancers are different, our bodies are different, and the way we handle crisis is different. I mean, some people just don't want to know anything, don't want information. And then others want everything imaginable.
Yeah,
so
every
it's,
piece of information.
yes.
Yeah.
Now, I don't know for you, Pat. Pat actually came through our organization as a hotline call.
Okay.
And I was reminded when we were sitting outside that I had talked to Pat right about the time that she was diagnosed.
In fact, the evening I was diagnosed, I called.
Was it the evening?
Yeah, yeah. So, and the weekend after that was the first Young Mothers Support Group meeting that Elaine had started for mothers of young children. In my case, I did not have that decision to make. My particular diagnosis, with my particular diagnosis, it was clear that I needed a mastectomy versus lumpectomy.
Okay.
So I did not have that one thing to worry about.
Okay.
But I have known many other women that are that have a very difficult time with that.
I'm sure. Now, you mentioned you have small children.
Yeah.
Yeah, you have 3?
Yes.
Little people, okay. And you were diagnosed about a year and a half ago. So what's the youngest, how old are your children?
2, 6, and 8.
2, 6, and 8. Okay.
My youngest was 13 months, and I was nursing her when I was diagnosed.
Okay. And at that time, had you known anybody your age who had had to encounter this?
No.
No.
No, I didn't.
Okay. So I guess your organization, Elaine, started the first support group for young women then, young mothers.
Yes, we just all of a sudden realized that a lot of young women were coming through the hotline. And it just seemed like too many young women, and we wondered, we were sure that their issues were specific to them and their family structure at the time. So we had them come together on a Sunday to see if there was anything we could do. And I can remember on that first Sunday afternoon, they were happy to find another woman their age who could understand where they were and that they could talk to freely.
That must have been a real comfort for you at some level to at least not be as alone with it.
It was a real comfort, but it was very frightening as well to walk into a room and to admit, walking into the room was an admission that, yes, you know, I do have this. Yeah.
When we come back from our break, you know, let's talk a little bit about your experience of the process of acceptance, because I'm sure that has several stages. It's not as simple as, okay, well, thank you very much, doctor. I mean, there's got to be time for that to sink in. When we return, we will learn more about recovery and self-care. Stay with us. Welcome back. When we left, we were talking about acceptance and that there must be different layers of acceptance. And I thought we could be guided perhaps by our next graphic. So we'll take a moment and take a look at that. This is from Dealing with Your Emotions, the book I Can Cope by Judy Johnson and Linda Klein. She mentions shock and disbelief, anger, denial,